I'm going to be taking questions at the end of this presentation. In patients with family history of genetic cancers, or those who are otherwise at high risk of pancreatic tumors, having the latest innovations and resources for identifying and tracking these tumors makes all the difference in every part of the treatment program. Since we're trying to avoid radiation and biopsies at any time, we use ultrasound screening as the first-line scan to image the pancreas. If there's anything suspicious, we can employ the scanning feature that tracks the hardness of the cancer, where benign tumors are generally soft and cancers are generally rock hard. If the ultrasound elastic component demonstrates hard tissue, then the likeliness of cancer is high. If the ultrasound component demonstrates hard tissue, then the likeliness of cancer is high and the area needs to be biopsied. In many countries, if the sonogram technology doesn't find anything, then biopsies are often avoided. Image-guided tracking of cancer is used internationally. When I first started in radiology, I finished my residency by going to Denmark to learn how to do image-guided biopsies under ultrasound, because this was not being done in the United States. Later, I went back to Europe to learn blood flow imaging, which is turning out to be the most accurate way of measuring cancer aggression. The yellow eye is jaundice, and that's often the first sign of cancer of the head of the pancreas because it blocks the green bile duct. You can see the rest of the pancreas is not connected to the bile duct, so cancer in these clinically silent areas often have no symptoms until it causes severe pain from wrapping around the blood vessels and nerves in the middle of the body or has metastasized. In this single-shot sonogram, the head of the pancreas is labeled with 2 arrows. The body in the middle lies over the big blood vessel, the aorta, which we can see in seconds with high accuracy. Now, the accuracy depends not only on the experience of the person doing it, but also the equipment and the body habitus. In other words, with very thin people, you get great images of the pancreas, and in very heavy-set people, we often have to resort to special imaging with ultrasound. More commonly, CT is considered the main way of imaging the pancreas in general practice. As I mentioned, the vascular landmarks are key because the pancreas surrounds the great vessels shown in red, and the stomach sits right above the neck of the pancreas. This is like a slice down the middle of the body. So it's a different orientation. You need 2 orientations in any imaging procedure to localize the cancer and triangulate the effects of the cancer on the adjacent organs. Surgical landmarks show the liver on top, and the arrows indicate the central duct of the pancreas. This is not the bile duct. This is the pancreatic duct, which is different. In this case, a simple ultrasound over the abdomen shows that it's 2 millimeters thick, as thin as a dime. Note the teardrop black vena cava, which is the huge vein in the center. Again, the vessels are the key factors because tumors that invade tend to block the great vessels. This is in French because the French perfected the pancreatic treatment using chemotherapies.